Now to hold the specimen in anatomical position, this composite viscera, that is the duodenum, pancreas and the spleen, you have to hold the composite viscera in such a way with your palm of your two hands, so that the left hand is slightly above than the right hand, because the head of the pancreas lies at the level of the first and second lumbar vertebra, whereas the tail of the pancreas lies at the level of the 12th thoracic vertebra. And the upper border of the body of the pancreas, you will see the tortuous splenic artery, and the posterior surface you will see the splenic vein. So this is the anatomical position of the composite viscera. You have to hold the duodenum in your right hand, and this is the first part of the duodenum, ascending part, second part, descending part, third part, horizontal part, and this is the fourth part, the spleen. I have already discussed the anatomical position of the spleen. So keep in mind, during holding the anatomical position of this composite viscera, the duodenum will rest on your palm of your right hand. The spleen will rest on the three fingers, left index, left ring, middle and the left ring finger, of which the middle finger will resemble the axis, and the spleen will be slightly above and the duodenum will be slightly at the lower level. Now regarding the applied aspect of the pancreas, you will read regarding the developmental anomalies of the pancreas. That is the annular pancreas, which is very important. Due to failure of rotation of the ventral pancreatic cord, the head of the pancreas may encircle the second part of the duodenum, which may result in the duodenal stenosis. Acute pancreatitis is a clinical condition, and the person who are sufferer, usually the alcoholic, or who are sufferer of the stone in the pancreatic duct, and the serum amylase level will be raised in case of acute pancreatitis, and the person will present with acute pain abdomen radiating to the back, vomiting and the fever. Now another clinical condition is the pseudopancreatic cyst, which is not a cyst of the pancreas, but it is a collection or accumulation of the fluid in the lesser sac, in which the epiploid foramen is closed. So there is a closed sac behind the cyst, the pancreas, that is the pseudopancreatic cyst. And another important condition is the carcinoma of the head of the pancreas. In carcinoma of the head of the pancreas, commonest structure which is obstructed is the bile duct, because bile duct is closely related to the head of the pancreas. Sometimes it is buried within the head, and in this case the person will suffer from the obstructive jaundice, and it may compress the pyloric part of the stomach, resulting in pyloric obstruction, or it may compress the portal vein, resulting in ascites.